For the first 2 years after I graduated, I worked for Professor Les Roberts as part of a consortium project between Columbia University, the Centers for Disease Control and Prevention, and UNICEF that was looking at grave violations against children in conflict and how to actually measure these so that we could improve programs designed to respond to them. So I worked for that project in Democratic Republic of Congo, in Central African Republic, in Palestine, and in Nepal. And then I returned to working with International Rescue Committee, who I'd worked with before coming to the program, and worked with their gender-based violence program in Dadaab, which are the huge camps on the border between Kenya and Somalia, before joining their emergency response team. And I'm the Women's Protection and Empowerment Coordinator within the emergency response team and have been deployed to Lebanon, to northern Syria, and to Democratic Republic of Congo to work as part of those responses. Yeah, I think my favorite part of humanitarian work is the people that I work with. I've met people that are very passionate about the work, they're very passionate about helping others, they're very passionate about working with women and girls and working on issues of violence. Most of the staff I work with are from the countries that we're working in, and they have taught me a lot, I'd say a lot more than I would learn anywhere else. So I definitely have a sense of solidarity, and I feel like it's the kind of job where it's a bit of a vocation. So you're working with people that feel the same as you do about very important issues. And you feel that solidarity with your colleagues, and you feel a kinship with them. So for me, it's a personal aspect that I value about it. I came because it was focused on humanitarian work, and it was geared towards people who'd been working in the humanitarian field to improve their skills. And so what surprised me was my favorite parts were the epidemiology classes and the more general public health classes, and then applying those to the humanitarian sector. So I have to say that I didn't even really know what epidemiology was before I came, to be honest, but I think having those skills and those frameworks to be able to think about what is a problem, how do we address it, and how do we know if we're successfully addressing it or not, I found tremendously helpful in applying to everything else that I've worked on. The thing that also drew me here was that all of our professors in the program on forced migration and health are practitioners. So they're not sitting in an armchair, writing about these things. They actually are still active in the field. They've been active in their fields for decades. And they're still committed to going out and putting these things in practice and being very honest with us about what works and what doesn't. So that's why I applied here, and I think taking advantage of knowing your professors, talking to them, making connections with them, they're all tremendously supportive of the students, and then the networks with other students as well, would be an added advantage to the education that you get here.